Welcome back to the Mental Health Minute. I'm Dr. Emily Mayfield, a licensed psychologist. First, I want to thank you for watching this video and being part of the Mindset Therapy family. With this channel, I hope to provide educational videos on mental health related topics. Sometimes people aren't sure if what they're experiencing is normal or whether they should seek mental health treatment. So with these videos, I discuss common mental health themes. I want to provide information that you can use to become a better you because I'm invested in your change. So please consider subscribing to my channel as a way to grow the reach so more people can be provided valuable information on their mental health. You can also turn on the notification bell to be informed of the next video when it's uploaded. I'll post a video every Tuesday and Friday, so check back soon. So for today's video, I'm going to discuss how you can decide whether professional help is best for you when it comes to mental health struggles. I'll discuss 11 signs that you might need professional help for mental health symptoms. I hope to break down the stigma of mental health and show you that it's okay to get professional help. Also, stick around to the end to hear the tip of the day. These are quick tips on ways that you can start to improve your overall mental and emotional functioning. Asking for help can be difficult. When we're young, we're encouraged to figure things out on our own. We're told to keep trying until we're successful. We're taught that perseverance to learn independence and to be successful as we get older. So what do you do when you find yourself in a situation in which you can't make it work and have things improve? What if you feel like you've done everything and still fall short on making the changes you would like to see? When it comes to mental health and mental health symptoms, it can be hard to recognize what's a normal experience and what would benefit from therapy. This is further complicated by the fact that most people don't talk about their mental health with other people, so they don't have a comparison for what they're experiencing. They feel alone, as if they're the only person going through something, and this can be isolating. You may have struggled for weeks, months, or even years to try to get better on your own, but nothing seems to work. Motivation alone is often not enough for changes to happen. There's no doubt that you're motivated for change and have tried what you think will work for you. Being unable to create the change doesn't mean you failed or that you'll never get better. It simply means that you need additional help. If you were struggling in an academic class, you would get a tutor. Similarly, if you want to get fit and lose weight, you hire a personal trainer. Getting help for your mental health is not a sign of weakness, it's a strength. You recognize a problem and seek out professionals who can assist you. Before we move forward, let's discuss what mental health even is. So mental health includes aspects of our psychological, emotional, and social well-being. Our mental health affects how we think, feel, and behave, and can have an impact on all areas of our life. When your mental health is stable, you can appropriately handle life and life stressors. When faced with a challenge, you can effectively come up with a plan to deal with the challenge. While some life events might be trying and difficult to manage, when your mental health is stable, you'll bounce back after the stressor of the life event has resolved. Mental health difficulties that lead to changes in our thoughts, mood, and behaviors might require professional help if it's impacting how we interact with others and leads to moods that we find difficult to manage. So now let's talk about the 11 signs that you might need professional help. So number 1 is difficulty functioning and getting things done. When our mental health is stable and healthy, new stressors is viewed as challenges for us to take on. We can appropriately recognize the problem, develop a plan to tackle the problem, and then enact the plan. When we are struggling mentally, we experience difficulties in one or all of these areas. You might find everything is overwhelming, and getting started on a task or sticking with it is too much to handle. Even things that otherwise were easy, such as taking a shower or washing the dishes, may become overwhelming and not get done. Number 2 is feeling worried or anxious most of the day. Worry is normal. It's a cue that there's a problem that needs our attention. Without worry, you wouldn't get things done or take steps to keep yourself safe. However, too much worry can cause problems. When you worry too much, you notice your focus is on the worry and not on the actual problem. The worry consumes your day and becomes paralyzing, which results in tasks not getting done. Number 3 is feeling depressed or sad most of the day, nearly every day. Just as worry is normal, so are sadness and depression. Experiencing a variety of emotions during the day is typical. However, when you find that you're primarily depressed or sad most of the day, nearly every day, then there is concern for a possible mental health condition. While it's normal to have sadness come into your mind when you watch a sad movie or have a sad memory, the sadness should be able to move along. If you find the sadness sticks around or develops into depression, then you might have a more significant issue that would benefit from professional help. Number 4 is a lack of motivation to get things done. So everyone has those times when they do not want to do certain things. The idea of laying on the couch or sleeping in sounds enjoyable and gives you much needed break from your otherwise hectic life. However, as with most things, this should be done in moderation. If you find that it is increasingly hard to get things done or motivated to complete work and home tasks, then you might be struggling mentally. Number 5 is you have mood swings. Our emotions come and go throughout the day and should freely move in and out of our life. The intensity of the emotions should be appropriate to the situation and quickly return to their baseline once the event has passed. Mood swings are when you quickly shift from one extreme to the next with your moods. The rapid change may also appear to be for no reason and out of your control. So number 6 is you have past traumas that you can't get out of your mind, or these traumas limit activities you do. So past traumas can impact our lives in many ways. If you've experienced trauma in your past and there are worry, thoughts, fears, and avoidance associated with the trauma and the memory, then you might need professional help to get you past this difficult stage. So number 7 is you experience physical symptoms with no known physical cause. Stress and anxiety can manifest through physical symptoms. If you find that you are experiencing multiple physical complaints, such as headaches, muscle tension, nausea, and sleep issues, then your stress and anxiety might be to a level that is difficult to manage on your own. Number 8 is you have thoughts of hurting yourself or others. Having thoughts of harming yourself or someone else requires professional help. There's a difference between thoughts and actions, but you want to have this addressed as soon as possible. Number 9, you notice increased substance use or using substances to cope. Substances can include alcohol, tobacco, drugs, over-the-counter medications, and prescription medications. If you find that you are using the substances in increasing amounts or more frequently, more than the recommended or prescribed dosage, or to cope, then you would benefit from assessment by a professional. The professional can assist you in understanding why you're using and ways to change or stop the behavior. Number 10, there are irrational fears that interfere with life. People have various fears they deal with. It could be a fear of animals, heights, public speaking, or many other different things. When your fears dictate how you live your life and interfere with the activities you do, it might be time to consider professional help. And number 11 is you just want to talk to somebody. Mental health therapists are trained in specific treatment techniques to address concerns that bring you to treatment. However, people often wait too long to come to treatment and suffer months or even years because getting the help they need might be difficult. Presenting to treatment sooner versus later is the best choice you can make. If you're feeling or acting differently or having difficulties you didn't have in the past, find a professional for an assessment. They can help you determine whether you would benefit from treatment or what to look out for to ensure your symptoms don't get worse over time. So if you're experiencing any of the 11 items I discussed, you might need professional help. This is especially true if you have tried to make changes on your own through web searches or reading self-help books. Professional guidance can help you make the changes that you're looking for. It's important to remember that there is no expectation you solve all your problems on your own. As you consider whether you need professional help, Don't compare yourself to others and whether your experience is as bad as theirs. We all handle things differently, and we cannot compare ourselves to others. The sooner you reach out for help, the less struggles you're going to experience on your own. There are many professionals out there waiting to help you. Seeking help is not a weakness. It shows strength when you can recognize a problem and find a way to address it with the assistance of a professional. So now for today's tip of the day. Do something that you enjoy. Oftentimes our lives are consumed by tasks we must do, and we stop doing the things that we enjoy. Doing things that we enjoy keeps pleasurable things in our lives, which helps improve our moods. Think of a hobby you enjoy and try to spend 30 minutes doing that hobby in the next few days. You can visit our blog linked below for more information on how to know if you should seek professional help. Also, check out our video on physical symptoms related to stress for more information on the topic we discussed today. I'll see you at the next video. Have a good day.